What is RSV? RSV is basically a respiratory virus. It's a more important virus when it comes to newborns and little children. It causes, your typical symptoms of a lot of runny nose, cough, but when it happens in kids under the age of 2, particularly kids who are 6 months and under, it can cause it will feel like a viral pneumonia type of thing. It causes a lot of inflammation, and so it's really easily spread and can cause a lot of havoc into newborns and young children. There is a season that we used to call RSV season, and that would usually start around November and go to about March. COVID has actually really messed everything up when it comes to that. We're seeing so many viruses come off season, and even previous to this year, previous to RSV being in the news, we're finding it was happening in the summertime, and so there isn't really a good RSV season right now. Right now, in mid and early November and even in October, we're seeing a lot of RSV, and so COVID knocked everything sideways. So right now, I would say everything is in play, and so we don't really have a COVID RSV season, but it used to be between November to March. The RSV infection can last anywhere between 7 to 10 days, but sometimes longer. I think all parents who have had sick kids have noticed that sometimes their kids will cough for 2 weeks and 3 weeks. And the problem with RSV is that it causes inflammation in your lower and in what is called your bronchioles, and it's your smallest airways. And it can cause mucus plugging, and sometimes causes wheezing, and sometimes a little bit of respiratory distress. And sometimes with that wheezing, you can sometimes cough for 2, 3, 4 weeks. And so, being a parent, sometimes it's really important just to watch your kids breathing, checking in with your primary care physician just to make sure that your kid's actually doing all right. I think COVID made it different. I think because we went into a mandatory lockdown, because I think we were trying to save lives, and at this moment, I still think that was the right decision. But what happened is that all the kids who usually got RSV, in the previous 2 years, they just didn't get it because less people were getting sick. People were wearing masks, they were socially distancing. And so what happened was a lot of that immunity that you would get or exposure you would get of RSV that would normally happen just didn't happen. And so everybody's like getting it for the first time, right? It's like none of us were ever out in the sun. We all went out in the sun, we all get sunburned. And so things like influenza, RSV, there's a thing going around, it's called rhinoenterovirus. That's hitting kids a lot harder than it used to. And so our immune systems are just not built up and not as strong as it used to be. And so it's hitting a lot more people. A lot more people are getting infected. And so that's spreading to more people. The differences between bronchitis, pneumonias, and bronchiolitis or RSV are a few things. One, I think kids can get acute bronchitis, but when you talk about, mostly we talk about with bronchitis in adults, those are usually people who are above the age of 40, who, they've smoked and they have damage to their lungs. Kids don't tend to get bronchitis, and that's more inflammation of your upper airways. And if kids do, they pass it really quickly, right? It's usually not a big deal for them. Pneumonia is different in the fact that a lot of times when we talk about pneumonia, we're worried about a bacterial infection, something that you can actually get antibiotics for and it actually makes it better. But in the majority of the time, and for most kids, it's not a bacterial infection. It's usually a virus, so you get a cold or you get a regular virus. With RSV, you can get what's called bronchiolitis, and that's where you get a lot of inflammation in your smaller airways. And like I said before, it causes mucus plugging, it can cause wheezing, it can cause a lot of respiratory distress. And so when you have a baby who's trying to breastfeed or trying to drink from a bottle and they're really congested in their nose and their airways are congested, it makes it hard for them to breathe, it makes it hard for them to eat. And so that's where, and sometimes their oxygen level can actually get lower, because if you think about a baby's lungs, think of it like a brand new tree. It doesn't have many branches, it doesn't have many leaves. And the same thing with your lungs is as you get older, you get more branches, more leaves, until it's easier to breathe and less, difficult to plug up. But when you're little, it plugs up really easily, and so that's why they have a harder time with it. A lot of time with RSV, after the age of 2, or if you're like 6 or 8 years old, it just ends up feeling like more like a regular cold. But that cold in your first grade or your 5th grade, that comes home into your newborn, and then it really does a number on them. Usually, the way that you can recognize a severe RSV infection in a child is, a couple of things. One is, how are they breathing? right? Are they sucking in underneath their rib cage? And we call those retractions. Sometimes they're working really hard to breathe. Sometimes if you look right at their throat, you can see a little dimple going into their throat. That we call that tracheal tugging. Or their nose is flaring because they're having a hard time, working hard to breathe. And so those are three of the symptoms that we commonly think about when we're talking about respiratory distress. But the other one is that even for your newborn or for your infant child, sometimes the way that they eat, the way that they breastfeed, their energy level, how well they cry, how good is their muscle tone. That'll tell you, is your kid doing okay, or are they starting to get lethargic and maybe need to get checked out? Is your kid starting to get dehydrated because they're not eating so well? Are the number of wet diapers going down? Are they crying without tears? The inside part of their mouth starting to get kind of like pasty because they're not developing enough saliva. So those are some of the symptoms that you will look for. One really hard thing about viruses is that there's no antibiotic for it, right? For a lot of times when kids are having RSV or bronchiolitis, the idea is, oh, I need medication to make this better. The difficult part with RSV is that there's not really a medication that you can give. A lot of times, even when you're hospitalized, they do a lot of suctioning. Sometimes they'll do breathing treatments with albuterol, which we use for asthma, but evidence for that isn't really great. There are some kids who, when we give the albuterol, it does help a little bit. So sometimes if you come to your doctor's office or to the ER, they'll do a treatment just to see if there's improvement. But a lot of times it's just more suctioning. There's a thing that we call CPT where you can cup your hands, and when you hold your baby, you kind of lightly pound on their chest to kind of just open up the airways and move the mucus around. But really it's just a lot of supportive care and just time. You can get RSV twice, much like most viruses, and then like the same thing that you see with COVID. Eventually, the antibodies do wear down and they go away, right? So anytime between 2 months to 8 months, your child could get RSV again. So the places that you probably get the RSV the most is probably like siblings who go to school. Got it at school, had a common cold, and then they gave it to their sibling. Sometimes you can get it from parents. Maybe, mom or dad went to work, got it from their coworker who probably got it from their kid. But the one big thing when it comes to RSV is that it's what we call a contact spread. So it's on surfaces, it's on your hand, right? And who are the most notorious people for not washing their hands? It's going to be little kids, sometimes adults and males, but when it comes in general, it's the little kids at school where they're touching things, they're on the playground, they're not washing their hands before they eat. I was just camping with my kid, and the number of times I had to remind him to wash his hands after he put his hand in something dirty, all the time, right? And so that's where it's probably coming more from the schools and other children. Especially when you have a newborn or an infant, decreasing the amount of people the baby's exposed to is a really big deal. But it's really hard because you get a lot of pressure from family members. You have like grandparents and uncles and aunts and cousins who want to come over. And I think some of the things that sometimes can be really nice is, number one, if they were recently sick or getting over an illness, or they feel like they're starting to get sick, is to go ahead and wait. Because even you might not be consider yourself infectious, you still can be, right? And just as like we see with RSV, what can be a common cold for an adult or for a kid, for a baby can be very serious. The second one is making sure everybody's washing their hands. And then if we want to go that extra step, maybe wear a mask, right? And I think that's a really important thing. The other thing that we don't talk about, especially with infants and newborns, is making sure that everybody in the family has their Tdap and their flu vaccine. Right? What we found out was that there was a lot of teenagers out there who didn't have their Tdap, and we used to do what's called TD. It was just tetanus. It didn't cover whooping cough, and they would end up giving newborns the whooping cough, and it can be severe and life-threatening for babies. And then getting your flu shot. That's so understated about getting your flu shot this season. Just like I talked about, we skipped a couple years of flu, and so it is hitting people much harder. But I think for infants and then for the elderly, RSV and then also influenza can be life-threatening. So in the long term for RSV, one of the things that we worry about is that it can be anywhere from 10 to like 40, 50% of newborns or infants who get RSV that can have like a little bit of childhood asthma. It causes all that inflammation that you see it actually causes like a little bit of a reactive airway. And so some of these kids end up needing the medication albuterol that's used for asthma. Some of them end up on inhaled corticosteroids such as Flovent or Pulmicort because of the inflammation. And as they get older, I use that analogy again for a tree. When the tree's little and it gets burned, that tree has a little bit of a difficult time. As that tree gets bigger and has more branches, more leaves, the asthma usually does resolve, but it does set you up a little bit more for wheezing. So lately in the news, they've been talking about RSV and influenza making a hybrid virus, and it kind of felt like Godzilla and King Kong had a baby, and we don't know. They're talking about how it can be very infectious, but I think like most other things, just like COVID, there's still stuff we're trying to find out. But I think the big thing is that if your kid gets sick and they're having any type of respiratory distress, they're any type of wheezing, not feeding well, it's still just seeing your primary care physician. If you can't see your primary care physician, especially overnight, if there is a lot of difficulty wheezing, not necessarily always just toughing it out to the next day, just because sometimes, especially when they're under 6 months, under a year of age, babies sometimes tire out, and that's where sometimes their oxygen level gets really low, and that's where it can get scary. Just to make sure that we go and touch base with some type of healthcare professional, and then also, if you're seen in the ER and your kid's given any type of treatment or medication, to follow up with your primary care physician so they know what's going on with your kid and how to treat your kid better.